Hi, I'm Jason DeBoe, and today we're going to talk about patient Billy Noble. Now, Billy's a 40-year-old Hispanic male with a past medical history of hypertension, poorly controlled because he doesn't always take his amlodipine, that presented with a sudden onset of slurred speech, hemocresis on the right side, a little bit of confusion and weakness. He was sitting at work when all of a sudden he noticed these symptoms, called out to his secretary, who then came in to help him. He's got really no pertinent medical history other than the hypertension, no traumas, no surgeries. Lives at home with his wife and his two kids. He does admit that he drinks on the weekends, and it sounds like he drinks a little bit more than he probably should. And he's a regular smoker, 1 pack per day for the last 20 years. So we're looking at 20 pack years. He's got a family history of hypertension, which he got from his father, and there's some diabetes type 2 that his mother has that he may not have yet, but he's probably going to end up with. When initially looking at Mr. Noble, you notice he's kind of a slightly obese but well kept Hispanic male, clean clothes, appropriately dressed, ANO times 4. Review of symptoms was unremarkable. Everything had resolved at this point because the symptoms only lasted about 15 minutes. His lab tests were all within normal limits, and his CT was unremarkable as well. So after this, we moved into the assessment portion. And so we started having to rule things out. We looked at stroke first, CVA or a stroke first. Now, stroke is going to be a cessation of blood to a portion of the brain, usually caused by a clot or a rupture. Usually you end up with a sudden onset of weakness in the face, the arm, the leg, usually on one side. Slurred speech, confusion, dizziness, trouble walking, gait issues. And sort of the big thing, the hallmark sign is going to be a headache, right? They generally complain of a headache. They can pinpoint that headache, and it's the worst headache they've ever felt in their life. We were able to rule this out in Billy's case because he didn't have the headache and the symptoms resolved on their own. And usually with a stroke, those symptoms don't resolve until we get something in there to fix that stroke. The second was a Bell's palsy. Now, Bell's palsy is a neurological disorder, sort of idiopathic, so not exactly sure, but they do believe sometimes viral infections can lead to a Bell's palsy. Now, that causes a sudden onset of weakness, paralysis on one side of the face. A lot of times that one eyelid may not open or close properly, some drooping in the mouth, things of that nature. Again, in Billy's case, we were able to rule this out because of the fact that Bell's palsy only affects the face, and Billy was having complete body symptoms. So, again, probably not it. Which leads us to TIA, or a transischemic attack, which, very similarly to a stroke, is caused by that interruption of blood flow to the brain. However, it's temporary. And because it's temporary, the numbness, weakness, the facial paralysis, trouble seeing, all of those symptoms that are very similar to that of a stroke are temporary. Then they generally resolve within 24 hours. So because this is exactly what we're seeing in Billy Noble's case, that's what we end up with. However, a TIA is not completely out of the woods because of the fact that these symptoms resolve, because within the next 2 to 3 years, you're at risk for having an actual stroke. So plan needs to go into place. He's already gotten the CT of his head. So the next thing we need to do is get an EKG because we need to make sure that we don't have any cardiac involvement here. We need to get him on some aspirin, 81 milligrams a day, statin, because that's going to help. We don't know exactly what his lipid profile is like, but we can pretty much assume that it's going to be poor, or that we're at least going to help reduce the risk of statin or cholesterol related strokes in the future. We're going to push him to get back on that amlodipine, that 5 milligrams, and we're really going to hound him to stay on his meds. Smoking cessation, because the smoking does make your vessels a little bit smaller, and that can, increase the risk. Weight loss, because he is overweight. Excuse me. Increased exercise, because we can't do this little I'm golfing, walking here and there. I want 30 to 45 minutes 4 times a week, and it needs to be meaningful exercise. Decrease alcohol, because that does weaken blood vessels, which again increases the risk of a stroke. Stress reduction, because he admits he has a very stressful job, and we have to be able to get stress under control, because that can also cause blood pressure to go up and things of that nature, which again increases the risk. We're going to refer him to neuro. Just for a follow-up, have somebody who's a subject matter expert talk to him, and maybe that'll help kind of drive home the message. And he's going to need to follow up with his primary care physician immediately, and that's in person. So these are the types of things we're going to need to do with Billy, even though he's a Hispanic male and they don't like to be told what to do. We really have to push this, because if we don't, we're going to lose this guy.